everybody, it's Mishta, and I have always got more madness. But today I have really great news. First of all, I passed my essay test. Yay! So only one more test, and that's math, and then I'm all good. I have my high school diploma. And I know that's not a big deal for most people, but for me it is, and I'm really excited. But anyways, to the main subject of the video, the Biktarvy. And I have been on it a week now. My little dog's over there barking. I've been on it a week now, actually a week and a day. And I wanted to make sure I had plenty of time to find out about drug interactions and any things that were going to go on with me so I could tell you about them. And so far, the Biktarvy is totally great. I haven't had any side effects, I don't think, from it itself. I have had a little issue as far as in the beginning, I didn't know that you weren't supposed to take it with the minerals that are in a multivitamin or the minerals that are in antacids like Tums and all that. And I think I mentioned that before. I was just finding out that information. But when I did find out, I called my nurse, and she actually called UC Davis Medical Center's pharmacy, their main pharmacist. And she was asking that person questions about what I was asking. So the pharmacist, first of all, the pharmacist said I had very smart questions, and it was really good to know because not everybody understands what these interactions mean. It won't kill you, so it's not like a drug interaction that can kill you, because there are drug interactions that can kill you. But this is not one of those. This is one of those drug interactions where the antacid or the vitamins, which is the extra minerals, calcium and all that, are going to make the HIV meds not work properly. So they will not be as effective in your system if you take antacids or vitamins within 6 hours of your HIV meds. Okay, so most doctors I've actually watched some videos on YouTube, and I've heard the doctors say you just need to space it out. Well, they don't specify what that means. To make your HIV meds work at the most optimal they can work at, then you need to take them 6 hours apart. No less. 6 hours or more. So for me, that means I take the Biktarvy first thing in the morning when I get up, because 6 hours later is usually at least lunch or dinner, and I can have a decent meal, take my vitamins, and I'm good. And so that wasn't a huge adjustment for me anyways. It wasn't too bad because I don't have to take antacids right in the morning. I'm not one of those people that wakes up and has heartburn already first thing. I usually have heartburn after lunch or after dinner if I eat something that ends up bothering me. So for me, it wasn't a huge change. It was a minimal adjust when you take your vitamins, and see if the Biktarvy messes with your stomach or anything because you didn't take it with food. Because I take it first thing, almost right after I get up, and then I eat my breakfast a little later on, and then later on after that I have my lunch and can take my vitamins, or I can wait till dinner and take my vitamins, whichever works out. So for me, it wasn't too hard of a change. It was pretty simple as far as timing and scheduling and all that, and so it wasn't too bad. But I just want to say the hardest part has been getting off of the old meds, which I did not know that the old meds were actually having a lot of drug interactions with the meds I was already on, like my inhaler and some other stuff that I was on that they took me off of. All those meds were being amplified by my old HIV meds, and I didn't know that. So now some of my inhalers didn't work as well. And it kind of freaked me out at first because I was like, oh my God, I'm having a reaction to the Biktarvy and I can't breathe. And it wasn't that. It was my inhalers are not working well enough because of the other HIV meds, the old ones, being a booster and boosting the inhaler effects. And it didn't make sense at first. I had to have my nurse explain it like a couple times and make sure I understood it. That I was like, so, because she kept saying you're going to have withdrawals, or you might have withdrawals from the steroids in your inhaler. And I'm like, what does that mean? Like withdrawals, does that mean like I'm going to be all aggro and irritated, or am I going to be all hyper, or what's going to happen? Because that's usually withdrawal signs. Are being irritated and aggro and, maybe depressed or something. And she was like, oh, well, you could experience that. But I was like, okay, what else does that mean? I'm like, does it mean that I'm going to be short of breath all the time and that my inhalers aren't going to work? Is that like a withdrawal thing? And she said, yes. For a little short time, while your body is getting used to not having the booster, your inhalers won't work as well. And actually, that's good news, but at the same time, I was like still worried, because I'm like, well, not being able to breathe and not having my inhaler work isn't good. So what do I do? So I just tried to limit my time outside and doing crazy activities for a few days, and now I feel like I'm a lot more back to normal, rather than having my inhaler. I have to take it like 5 times a day and have it not work as well, as opposed to when I took it only twice a week. Before, when I was on the other meds, I only had to take it twice a week, and now I'm taking it 5 times a day, and it wasn't working. And so I was trying not to panic and just go, it's okay, it's a side effect from getting off those meds, and it's better, I guess, to get off those meds, because you don't want that to happen, with anything else that you end up taking. You don't want it to be amplified, you want it to work right. So I had to learn a lot. And it took quite a few days. The nurse that I talked to, she was super cool. She said, I've been looking online and I've been asking that pharmacist for 2 days straight. And she said, you had really smart questions. And it was good to ask, because 6 hours is more than what she knew. She's like, I don't think the doctor even knows that it's a 6-hour time period that you need to wait in between taking the HIV meds and the antacids or the multivitamins. Most doctors are just saying, wait a little while, give it a little time. And no, it's 6 hours. Okay. 6 hours is kind of a lot of time. So I just wanted people to know that I had to learn things. I would like to teach them what I learned. So hopefully this doesn't happen to me again, as far as I won't be on any meds that are a booster. So the last time when my doctor switched my meds, he should have took me off the booster as well. And then maybe the Descovy wouldn't have reacted the way it did in my body. So I'm glad it wasn't a more severe reaction. But I learned to ask questions and drug interactions, because if I had known about that myself, I could have gone, hey, this big, huge rash and all this craziness really is the drugs interacting together, but it's not the Descovy being bad for me, it's it reacting to another med. So, and I would have known that. So hopefully now I know to always check the drug interactions and always just be vigilant about it yourself, because if you don't ask, you won't know. And a lot of times, granted, a lot of doctors are just going, yes, don't take antacids with them. A lot of doctors are saying multivitamins are no big deal. Well, this pharmacist at UC Davis Medical said the minerals in a multivitamin are a big deal, and you do need to space it out 6 hours as well. So I want the right information to get out there, and if you need to, call UC Davis, contact them online, and then that's a safe amount of time, 6 hours or more, And she said no less than 6 hours. And I thought, okay, that's pretty adamant, no less than 6 hours. So I'm learning new things. The nurse learned new things, and the pharmacist was really happy that I asked those questions, because again, the nurse and the doctor and all these other people are learning with me. So it's always good to ask questions. It really can't hurt. All they can do is say, something you already know or something you guessed. So it's better to know than to guess or to wonder or whatever. So I hope this helps people. I'm not trying to bash any doctors or anything like that, because doctors try to tell you what they know. And maybe they never looked up what it means by don't take them together. Maybe they just thought, oh, if you give it a couple hours, it's no big deal. Which I thought a couple hours, no big deal. But no, 6 hours is a bigger deal than just a couple hours. And it's important to make sure it's 6 hours apart, because you want all the meds to work right. Just like you want the vitamins to work right. You don't want the HIV meds to counteract the vitamins, and you don't want the vitamins to counteract the HIV meds. So hope this makes sense. It took me a minute or two to ask other questions to make sure I understood. And so, but I'm kind of a layman when it comes to all that and the scientific stuff. And I just ask questions. So really, it can't hurt. It's kept me alive for 20 years and kept me going on, what the doctor says. And listen to your doctors, listen to the pharmacy, and just ask. It can't hurt. I mean, all it can do is tell you something you already know, or you can learn something. So win-win. So thanks for watching. And please like, comment, and subscribe. I just want to help people and tell them to try to do the right things to help themselves. And you can live a long, happy life with HIV. It is no big deal. And it's great, and now it's cool. You can be an advocate and you can help other people and just use your knowledge. Knowledge is power, and having HIV for 20 years is a lot of knowledge, and I just want to keep sharing it. So have a peaceful day and keep watching and keep living your best life. Peace.